Hey guys, what's up? It's Noelle. Welcome back to my channel. So if you guys are new here, I am a part-time NICU nurse. I work night shift and I'm also in grad school for healthcare informatics. I am trying to transition from bedside nursing into something else, but as you can tell by the title of this video, I am answering the question, what is a NICU nurse? Someone actually commented on one of my videos asking if a NICU nurse takes care as the mother as well as the baby, and that question kind of inspired this video. So to start off, what is NICU nursing? NICU stands for Neonatal Intensive Care Unit. ICU, you'll see that a lot in hospitals. Hospitals have a lot of ICUs. There's pediatric, there's adult ICUs, there's also neuro ICU, so don't get that confused with NICU. But NICU stands for Neonatal ICU. Neonatal meaning babies. NICU nurses can take care of infants and newborns up until the age of 2. Once they hit 2 years old and above, that's considered pediatrics. That applies to floating, which means when the NICU is overstaffed, we have extra nurses, we don't need them. We'll float sometimes to pediatric floors. And when we float to pediatric floors, we can only take care of patients who are 2 years and under. So if you float for some reason and you're taking care of someone above 2 years, you should not be doing that and talk to your charge nurse. So I did want to clarify really quickly that NICU nurses are supposed to take care of infants or patients that are 2 years and younger. However, pediatric nurses can also take care of 2 and under. There's no clear okay, NICU nurses only 0 to 2, and then pediatrics is 2 to 18. Pediatric nurses can take care of anyone who's under the age of 18. Usually the scenarios for that is basically a NICU baby goes home, gets discharged, maybe isn't feeding as well, or something happens, they get sick, they have to come back to the hospital. They usually will go to the pediatric floor because the NICU is for babies who have been just born and they go straight to the NICU. None of the babies go outside or have been home. So if a baby from home comes back into the NICU, they're usually considered dirty. I know that sounds bad, but usually they are put under some contact precaution just to prevent any of our NICU babies who haven't been in the outside world from getting sick, because obviously a nurse is taking care of that one patient and then maybe 1 or 2 other babies as well. And then another instance where a young infant newborn would go to the pediatric floor instead of the NICU is if the baby is born healthy, goes home with mom, maybe gets RSV or gets sick or whatever it is, and they have to come back to the hospital. Even if they're only a couple weeks old, a couple months old, they'll still go to the pediatric floor because again, the NICU is really for babies who haven't been in the outside world or gone home at all. The patient population in the NICU is premature babies, babies who have a low birth weight, who have congenital heart defects, who have GI issues, anomalies, surgeries, who need surgery. The list goes on, but those are a few things. The patients can stay from, a couple days to a couple of months. It just depends on how sick the baby is. Premature infants can have a lot of problems depending on how premature they are. Usually if they're born between 23 and 28 weeks, they may have more problems just because that's super, super young. A term baby is considered between 37 and 40 weeks. 40 weeks is textbook full term pregnancy. Anything below 37 weeks is considered premature. If a baby is born around 36 weeks and 6 days, or in that 36 to 37 week range, depending on where you work, some doctors may require them to come to the NICU. Some might allow them to go to mother baby with mom. It also just depends on how much they weigh and if they need any oxygen or are having any trouble with anything else. I do want to specify that there's also labor and delivery, which deal with moms when they're pregnant, they give birth and labor and delivery. And then there's postpartum mother-baby unit where healthy newborns go and they stay with their moms, usually in their room in a bassinet. So that's kind of what you typically would think of when you're thinking about pregnancy and delivering a baby. The NICU is only for newborns who have any issue that mother baby can't really take care of. So whether that's just sugar, they have low sugar, which is not good, whether that's just they need some phototherapy for a high bilirubin, or whether that's they're born at 23 weeks, they're a micropreemie and they need a lot of support, and they will need a lot of support for probably up until their expected due date. In the NICU, like I said, they can stay for a couple days or up to a couple of months. generally when we tell parents, or their parents are asking, when will my baby be released from the NICU, we usually say around the due date, give or take 2 weeks. So maybe 2 weeks before the due date, maybe 2 weeks after. That's obviously not a guaranteed date. It really depends on the baby. In the NICU, everything is based on how the baby behaves. Each patient is very individual. You can't really compare, you know, one NICU story to another, but that's the patient population. We don't give care or provide care for the mothers, but the mothers are allowed to come down to the NICU. They often come within the first 24 hours to obviously connect and bond with their baby, because if they're coming to the NICU, there's usually a NICU team in the delivery room, and oftentimes the baby will go directly from being born into the NICU. So parents, or the mom, doesn't often get to see the baby before they go to the NICU. So mothers come down, the caregiver, the parent, whoever's involved. As a NICU nurse, it's your job to educate them, teach them about any disease processes that the baby may experience, and also just educate them about the NICU itself. It's a very strange place for parents because, one, they're not expecting for their baby to be there, and two, it's just very unique. So even though we're not giving direct care to the mothers or the caregivers, we are there for support and to teach them. Other things I wanted to mention really quickly with NICU nursing: you can take a certification to just enhance or show that you have a greater knowledge in NICU nursing. You can also become a manager. NICU nursing usually has educators, so that's also an option. And then you can become a nurse practitioner in the NICU. The NICU also has to have a delivery team, like I was previously mentioning. This is the team that shows up to deliveries. Mom is a known high risk that includes multiples, twins, triplets, etc. Or if something was prenatally diagnosed, meaning that, you know, mom going to her checkups and ultrasounds, they found something and they're aware of that anomaly at delivery, they might need a NICU team there. Or if we know the baby is premature, again, which is under 37 weeks, a NICU team will be there. Meconium aspiration, which means the infant actually stools in the womb, which can get into their lungs, which is not good. So those are just a couple of examples of why a NICU team would need to be at the delivery. The team usually consists of a doctor, a nurse, and a respiratory therapist. So there's usually a bed in there, like a warmer for the baby to be on, for it to be weighed, and for it to get oxygen if needed. The delivery team normally stabilizes the baby in the OR or delivery room, and then brings the baby to the NICU, where it will stay for however long it needs to stay. And then the only other thing I want to mention is that NICU, you can also be on a transport team. Some hospitals have their own NICU staff nurses who transport babies, meaning not every hospital has the same capabilities for a NICU. There are 4 different levels. 1, 2, 3, and 4, 4 being the highest. So if a baby is at a level 2 NICU or level 3 NICU, but they need higher care, they'll be transported via helicopter usually, or ambulance. They'll be transferred to a hospital who can provide whatever it is that they need. So that's also an option. Some NICUs have their own NICU transport team, but a lot of hospitals, especially children's hospitals, will have their own separate transport team, not including staff nurses. Like, their only job is to transport patients back and forth, including babies. So that's another option with NICU nursing, and something you'll see within the unit while you're working there. That's kind of the main summary of what a NICU nurse is. I hope you guys learned something. If you did, give it a big thumbs up. Don't forget to subscribe and hit that bell for notifications, and I will see you guys in the next one. Bye!